Hi, it's Dr. Hart again, and I'm back with more practice questions. Number one, the nurse is providing home care for a client who traditionally drinks herbal tea to treat an illness. How should the nurse respond to a request for the herbal tea? Number one, we do not allow our clients to drink herbal tea. Number two, why in the world would you want to drink that stuff? Number three, let me check with the doctor to make sure it is okay to drink the tea with your medicines. Number four, I have to fill out a lot of forms that you will have to sign before I can do that. And I'll give you a minute to think about this and we'll come back and talk about it. All right, let's come back to this one. And the correct answer is C, or number three, I'm sorry. Number three, let me check with the doctor to make sure it's okay to drink the tea with your medicines. This is perfectly normal, and in other cultures, they are using herbal teas, okay, for health and wealth. So as long as it's okay with the doctor and it doesn't interfere with any of their medications or other treatments, there's no reason why your patient can't drink an herbal tea. Okay, let's look at the other answer choices. Number one, I'm sorry, we do not allow our clients to drink herbal tea. That's very assuming. That's not even giving the client, you're not advocating for the client. You're not giving the client autonomy by giving them the option that to ask the doctor if it's possible. Number two is totally disrespectful in the way it's worded and stated. Why in the world would you want to drink that stuff? Number one, we try to avoid why questions. Number two, that's just plain disrespectful, that response. And number four, I have to fill out a lot of forms that you will have to sign before I can do that. And that's not true. It doesn't require a lot of forms. It would just require communicating with the doctor to get approval. All right, so we want to make sure the herbal tea doesn't interfere with any of the medications that the client is currently taking. In which way can nurses develop cultural self-awareness? Number one, ask peers and colleagues about practicing cultural competence. Number two, objectively examine one's own beliefs, values, and practices. Number three, realize nothing can be done to change one's values and beliefs. Or number four, assert to others that personal biases cannot be changed. Okay, I'll give you a minute to think about it and then we will come back. Okay, let's come back, and the correct answer is number two, the nurse, in order to develop cultural self-awareness, the nurse needs to objectively examine their own beliefs, values, and practices. And they should also take a look at their own biases. Everyone has them. Assumptions. Everyone makes assumptions. When you walk in the door of your patient's room, for example, making an assumption would be like if you see your patient is an older adult and the person in the room is a very much younger female. Making an assumption would be walking in and assuming that the visitor is the client's grandmother. I mean, grandchild or child, when it may not be. It may be their spouse. So those are assumptions that us as nurses, we need to be very careful about. So when you are developing your own cultural awareness, you're examining your own biases and taking a look at how those can affect how you care for your patients. Okay, so let's look at the other answer choices. Number one, ask your peers and colleagues about practicing cultural competence. That's not really relevant in this case. Number 3, realize nothing can be done to change one's values and beliefs. That's not really true. Those values and beliefs can be considered when you're treating your patients. And number 4, assert to others that personal biases cannot be changed. Okay, and you as a nurse should be aware of the role of cultural influences in your own lives objectively, examining your own beliefs, values, and practices, then identify and reflect on those personal biases. Okay? A client nearing the end of life requests that he be given no foods or fluids. The physician orders the insertion of a nasogastric tube to feed the client. Which situation does this create for the nurse providing care? A, the nurse must follow the physician's orders. B, the nurse is unable to provide care for the client. C, the nurse faces an ethical dilemma about inconsistent courses of action. Or D, the physician's order creates a barrier to establishing an effective nurse-client relationship. Okay, I'll give you a minute and then we'll come back. Okay, let's come back to this one. And the correct answer is C. The nurse faces an ethical dilemma about inconsistent courses of action. So an ethical dilemma, that's where the 2 or more of the clear moral principles apply, but support mutually inconsistent courses of action. In this case, the nurse has to decide what to do based on ethical decision making and take action that can be justified ethically based on that process. Okay, so letter C, the nurse is facing an ethical dilemma in this case. The client is requesting no foods or fluids in their end of life. So the doctor inserting an NG tube, that's an ethical dilemma that the nurse must decide how to proceed with this client. So let's look at the other answer choices. A, the nurse must follow the physician's orders. This isn't necessarily true. If this crosses or goes against nurses' ethical beliefs, they can question that order, okay, with the doctor. B, the nurse is unable to provide care for the client. This isn't necessarily true either. The nurse just needs to decide what action they're going to take in this regard. And D, the physician's order creates a barrier to establishing an effective nurse-client relationship. Okay, this isn't really what it is. It really is an ethical dilemma, okay, that the nurse is facing. A nursing student caring for an unconscious client knows that communication is important even if the client does not respond. Which nonverbal action by the nurse student would communicate caring? Number 1, making constant eye contact with the client. 2, waving to the client when entering the room. 3, sighing frequently while providing care. Or 4, holding the client's hand while talking. Okay, we'll give you a minute and then we'll come back. Okay, let's come back to this one. And the correct answer is 4, hold the client's hand while talking. So think about the stem of the question. You're caring for an unconscious client, okay? This is a client who is not awake and aware, but studies have shown that unconscious clients can still be aware to some extent of their surroundings. They may not be able to respond, but they may still be able to hear you. So caring for an unconscious client Nurses should be very careful about their discussions around the client and still be respectful, even though the client doesn't appear that they can hear you. And even though they're unconscious, they may or may not hear you, they may or may not see you, but they can still have tactile senses. And so holding the client's hand while talking, this is how you can have an effective nonverbal, and it says nonverbal action in the stem of the question. That's a clue. So there are verbal actions and nonverbal actions. Okay, verbal actions are obviously talking to your client. Nonverbal actions are touching your client's, holding the hand while talking. So that tactile sense is a form of a nonverbal communication that it would be very useful to express your feelings of comfort, okay, with your client as you're providing your care. Here's a delegation question. Which of the following nursing care tasks is acceptable for a graduate nurse to delegate to an unlicensed assistive personnel or UAP? And I did cover other videos on delegation. I will link those down below, okay, in the description, so you can refer back to those and get some more practice on delegation, which is a very important topic for you to cover. Okay, number 1, assisting a client with ambulation. Number 2, evaluation of nursing care delivered to a client. Number 3, initial and ongoing assessments. Or number 4, development of a client teaching plan. And we'll give you a minute and we'll come back. Okay, and the correct answer on this one is letter number 1, assisting a client with ambulation. That is something that the graduate nurse can delegate to the UAP. Okay, bed baths, bed making, okay, vitals if they've been trained properly on how to conduct vitals. Let's look at the other answer choices. Number 2, evaluation of nursing care delivered to a client. No, the UAP does not do evaluations. Okay, those evaluations are part of the nursing process, and that would be conducted by the registered nurse. Number 3, initial and ongoing assessments. Again, assessments are part of the nursing process. Assessments have to be conducted by a registered nurse. And number 4, development of a client teaching plan, which is an intervention, is part of the nursing process as implementation. So the teaching, any client teaching, must be conducted by the registered nurse. Okay, so the tasks like ambulation, assistance with meals and hygiene, obtaining vital signs, those are all acceptable tasks for the UAP to perform. Okay, last one. While caring for an older adult male, the nurse observes that his skin is dry and wrinkled, his hair is gray, and he needs glasses to read. Based on these observations, what would the nurse conclude? Number 1, these are normal physiological changes of aging. 2, the observations are not typically found in older adults. 3, these are abnormal observations and must be reported. Or 4, extra education will be necessary to prevent complications. We'll give a minute and we will come back. All right, let's come back to this last one. And the correct answer is number 1. These are normal physiological changes of aging. Dry skin, wrinkled skin, the hair is turned gray, and they need glasses to read. These are normal physiological changes of aging. and they are not abnormal, and no additional education is necessary as the changes observed do not lead to any complications. Okay, and so that's it for this one. Watch out for the next one. All right, take care and have a great day. This is Nursing with Hart, PhD. Check it out.